This Medisynced ECG review will focus on case number 433 from ECG Wave-Maven. Copyright information is provided here. This ECG is from a middle-aged woman. It's most consistent with which one of the following diagnoses? The answer, pulmonary hypertension syndrome. This ECG shows prominent resting sinus tachycardia at a rate of about 120 beats per minute. There's PR prolongation, especially for the sinus rate, at about 210 milliseconds. The most notable findings are right atrial abnormalities. We see in leads 2 and in V1 that there are tall peaked P waves. There's also markedly rightward QRS axis deviation at about 120 degrees. There's relatively tall R waves in leads V1 to V2 and T wave inversions in leads V1 to V3. This constellation of findings is virtually diagnostic of a severe right heart overload syndrome. In this case, the patient had chronic pulmonary hypertension, which was multifactorial, including severe restrictive lung disease. Note that a relatively tall R wave in lead V1 is an ECG marker of posterior infarction, equivalent to a pathologic Q wave in posterior leads, which are generally not recorded. However, posterior infarctions would not account for this ensemble of findings, also including right axis deviation of the QRS, peaked P waves consistent with right atrial abnormalities, and ST-T wave abnormalities consistent with right ventricular overload. Furthermore, what is called posterior MI by ECG is usually associated with concomitant evidence of inferior and/or lateral wall involvement.